By this time, the construction, conversion, and expansion of Wuhan's existing medical facilities were underway around the clock. Every possible avenue was being explored for increasing hospital capacities. In fighting the war against COVID-19, the celebrated China Speed was being deployed. In less than 2 weeks, Huoshanshan and Leishanshan hospitals were built. Jinyingtan Hospital increased its intensive care units from 1 to 5. And at Tongji Hospital, people worked day and night for 48 hours straight to build new wards to accommodate additional hospital beds.
把原来的就连夜改造，连夜2个晚上，把110平米的房子改到了5000多平米。
Despite the increasing supply of beds, the city was still struggling to meet the surge in demand for hospital care.
我们日常是2000嘛，22号就到了5900，最高的一天是15700，没完没了的接，我觉得没问题。可是问题是还有那么多我没有接起来的，那才是最大的问题。
If infected people couldn't be admitted to hospital quickly, they couldn't receive the urgent medical treatment they needed. This, in turn, meant the risk remained that the epidemic could spiral out of control. In view of the battlefield situation, President Xi Jinping instructed that hospitalization and treatment must be provided to all those in need. The goal was to control the source of the infection and prevent the spread of the virus. In this beautiful city on the Yangtze River, millions of people were facing increasing hardship.
I是1月18号发烧，然后我爸爸是在1月25号，就是初一的时候也开始发热发烧，凌晨3点钟排队，晚上凌晨12点回家，因为这边的5医院7医院根本都不收，因为它也是爆满的模式，已经爆满了。
So Liu and his family went into home quarantine and treated themselves.
最后什么时候进去？
方舱医院收的我。
什么时候
？2月6号。
The temporary treatment centers brought renewed hope to the suffering city. Liu Meng and his father spent several days in one, undergoing treatment and recovering before finally being discharged. In a 35-day period, more than 12,000 COVID-19 patients with mild symptoms were treated in these purpose-built facilities.
很难，而且这是过年，这不是你国家用钱都可以买到的。这个时候是需要强大的国家凝聚力来调动资源，这才能办到。
你看我们今天是不是又是豪华晚餐呢？
During the war against COVID-19, several key battles were decisive in securing overall victory.
大批的患者没有能够及时的收入到医院来，会造成更进一步的家庭和社区的感染。这个呢是加剧疫情的最重要的因素。我们必须想办法解决收治容量的问题。
The temporary treatment centers were specially designed mobile medical facilities of a type first used in the wake of the Wenchuan earthquake in 2008. The unit was represented in the military parade celebrating the 70th anniversary of New China. However, they had to be converted to accommodate more beds. On February the 3rd, construction of the first 3 temporary treatment centers got underway. By the evening of February the 5th, the first patients were being moved in.
非至善之法，但是没有比它更善的办法的时候，是解决收治的这样一个主要矛盾的现实之策。
February the 12th would prove to mark the peak of the epidemic, with almost 13,500 new COVID-19 cases recorded in Wuhan. 92% of them were first-time suspected cases identified by imaging testing, a technique that, by speeding up the diagnosis, allowed the patient to be quarantined much earlier. There was no time for delay in building the temporary treatment centers and providing the desperately needed additional hospital capacity. 30 specialist facilities were hastily built, and 16 were put into immediate operation, providing an additional 30,000 new beds. The number of hospitals treating COVID-19 patients increased from 2 to 86. The situation had been transformed, from patients waiting for beds to beds waiting for patients.